Go ahead and get started. Councilwoman Sepulveda, do you want to go ahead and make your announcement?
Yes, thank you, Chair Toombs. For everyone who needs Spanish translation, Nashville Noticias will be translating today's meeting on their Facebook page, and I'll share that as well. Para todos los que necesitan interpretación en español, si quiere ir a la página de Facebook de Nashville Noticias, allí puede encontrarlo. Ellos van a tener la junta de hoy. Si hay alguien en la audiencia que vaya a necesitar interpretación hoy, yo les puedo ayudar. Nomás vengan y díganme y yo les ayudo. Anyone who is at home and would like to be at the council chambers, if you all show up, I'm happy to help translate if you are not going to be watching on Nashville Noticias. Just let me know. Thank you, Chair.
Thank you, Councilwoman. So, today is the big day where I talk about my proposed substitute. And everyone should have a copy of it. And I'll just go through it. I'll go through it just line by line, and then we can dig into it after I've gone through it. So I'll just start from the top, looking at revenue sources. The proposed substitute reduces the 4% fund by $4,481,900. It reduces the contingency utility fund by $250,000. It reduces the judgments and losses fund by $6.5 million, and it eliminates the emergency response fund by $5 million. The expenses, it adds 15 fire and 10 EMS positions for $2,250,000. It adds 3 positions to animal control for $170,200. It gives money to the mental health nonprofit, that's the Mental Health Cooperative, that's partnering with MMPD on co-response, $818,000. It includes the 2 amendments from the Civil Service Commission, and that is for a total of about $5.2 million. It funds 17.8 FTEs for parks for $1,075,000. It includes $125,000 for recreation center programming. For MMPS, it includes $1.2 million for pay for the 7 professional development days, $1.4 million for the advocacy centers for the remaining elementary schools, $545,900 to reduce the student to school psychologist ratio, $59,100 for 1 FTE for the East Convenience Center, $150,000 for a public works fee study. For public library, $763,000 to add Friday library hours, $525,400 to add library curbside service. For social services, $150,000 for 2 FTEs, $100,000 for the Metro Arts Restorative Program, $50,000 for training materials for human resources, $1 million for a Cure Violence North Nashville pilot, $200,000 for the NBC Leo Conference, $277,800 for various expenses of the Metropolitan Council, 2 administrative officers, travel, translation services, and software needs, 2 FTEs for the county clerk for $128,700. And as you can see, this all balances out. It is structurally balanced, $16,231,900. Now I will gladly take questions. If I need to dive deeper into anything, I can do that as well. Councilwoman Johnston.
Thank you. I'm just a little shell-shocked from the last emergency that we had, so I wanted to talk about eliminating the emergency response fund. Can you just go a little bit more into that and how that would affect our emergency response?
So this year, we will have $133 million in American Rescue Plan funds, as well as another $133 million next year. So that's our emergency response fund.
Okay. And so reducing the 5% to 4%, we're not taking the whole, so we'll end up being like 4.5%.
Right
fund?
now, it's at about 4.5%.
Okay, that's perfect. And then I'm sorry, time out. The fee study for administrative, can you just tell me exactly what that fee study is for?
So they're on Councilwoman Allen's wish list. There was a request for the 5 FTEs for the right-of-way for the fiber installation. When I followed up with Director Whitelaw, she was not sure of how many FTEs that she would need and how, because the funding source was to increase fees, and she also was not aware of how much she would need to increase fees, so she asked for a fee study to make that determination.
Okay. And then everything, so the Cure Violence North Nashville pilot, what is that pilot?
So that would be under the Community Safety Partnership that we already have the state funds for, the $2 million. So it is adding $1 million for a pilot that is specifically for North Nashville.
Gotcha. And so anybody can apply to use those funds for whatever they're
Any organization that has the scale that would be able to take on that kind of project.
Okay. All right. Thank you.
Councilman Young and then Councilman Druffel.
Thank you, Madam Chair. Just a kind of housekeeping question. On some of these, I think that there were not specific wish list requests for them, maybe? Or were I'm just trying to remember because I wanted to see a breakdown. I don't remember seeing the one for the Metro Council office. Was that a wish list thing in there? And
Councilman Rosenberg.
Okay, I'll go back in there and find it. I just didn't remember that one. Thank you.
Yeah, and it's on the wish list as $650,000.
Okay, but all of these were wish list items? And I'm only asking that just so
that's
so I
fine.
can dig into the details of each one.
All of them except the funding for the mental health nonprofit, because that was my personal one. So
Right, that's what I was, yep. Thank you, Madam Chair.
You're welcome. Okay. Councilman Druffel and then Councilwoman Vercher.
Yeah, thanks, Chair. Just checking, one of the things I had requested was money for housing for homeless. I didn't see anything in here. Any thoughts on possibly why it didn't get in?
So I did not include that in the draft because I consider that to be more of a capital needs, and so that wouldn't come out of operating because I consider that to be actual physical housing, and so that would be a capital expense. It wouldn't come out of the operating budget.
I think there were some components in there that could be operating. It just sort of depends, but I'll get some more details and amend that. Thanks.
Councilwoman Vercher.
Thank you so much, Chair. I can't remember. We did a series of fee studies. Maybe if Director Cooper or I don't know if Mr. Jameson is up there. Which departments was included in those prior fee studies that allowed us to increase fees? I don't remember which departments. I thought, and Councilwoman Henderson isn't here, I thought Public Works was included when she was the chair of Public Works.
I know it was codes and planning primarily. I don't remember if there were any Public Works right-of-way fees that were examined at the time or not, but I do know that planning and codes were the two primary.
Can we just double check to make sure that the results of that study isn't lying around somewhere and we haven't utilized? Is that Councilwoman Henderson up there? No, that's Councilwoman Allen with the broken wrist. Okay. And then on the Cure Violence, the pilot, who's going to actually own that?
It will be under the Community Partnership Fund, which is housed under Ron Johnson, and I believe John Button also works with that program.
So they'll do the reporting and all of that?
all of the metrics and will be housed within that. I don't know what to call it, a division, partnership.
The department.
Department.
Will it still follow the same operational process where these funds are on a reimbursement method?
I'm getting head nods saying yes.
Can they verbalize it for the record? And state who you are and what department for the viewing audience?
Yes, thank you, Council Lady. John Bunton, Director of Community Safety. Could you restate the question? And I just want to make sure that I respond appropriately.
The procedural for these nonprofits, one, to apply, and two, to obtain the funds. Are we still doing the reimbursement method? In other words, these nonprofits have to front the cash first, supply us with receipts, audits, and et cetera, before we will reimburse them for any charges incurred.
So Metro ordinances, there are two ordinances which govern reimbursement dating back to 2013 and 2014. And they set three primary requirements for any direct appropriations. Appropriations have to go to nonprofits that are registered 501c3s, that are registered with the Secretary of State. And the third requirement is that in order to receive a grant of more than $5,000, a nonprofit would have to have an audit. So the Community Safety Partnership Advisory Board is in the process of working with Ron Johnson and me to set up the process. They currently envision a two-track process for very small nonprofits, which have a budget of less than $50,000. They would be eligible for grants of less than $5,000. So that is the one track which current ordinance permits. We will recommend that be in a grant format, so very small grant of less than $5,000. For larger community organizations with evidence-based approaches to reducing violence, they will have the option of applying for a larger grant. That would be in a performance management contract where they would work with Ron Johnson in our office to develop a contract which would probably have quarterly payments, metrics, and so forth. Both of those grants, small and large, would go to Metro Council for approval. So the council will review and approve all grants made from the Community Safety Partnership Fund. We're currently thinking in two tracks, though, because of existing Metro ordinances.
Okay, perfect. Just want to make sure that, in that nonprofit space, feedback in the past is that the bureaucracy of it ended up being more taxing for the nonprofit organizations to even participate. In other words, it ended up creating more of a hardship for them. So on the audits, are they going to be required to do is the A133, or will that be a different audit? Because I believe the A133s are a little more expensive.
We've been working with the Center for Nonprofit Management to see if a full audit would be required or if what is known as a fiscal review, which is a slightly less expensive audit, would suffice. That's something we're also talking with the legal and finance about. But one of the advantages of using the community safety partnership structure is it provides for technical assistance to community groups. Our purpose is to support and grow groups to help them be more effective with their work. So providing that audit assistance is one of the things that we'll be looking for nonprofit and private partners to help us do so that these groups can grow and that we can balance that ease and accountability.
Okay, good deal, because I know the audits excluded a lot of minority nonprofits. And then, golly, I'm getting old. I had another question. I just can't remember what it was, Chair. For this process, you can still only apply once for funding, or can you apply multiple times can you do 5,000, 5,000, 5,000? Or is it you can only just apply one time? I know with the different mayors we've we've changed that process. So what's the current process for the nonprofits?
The advisory board is in the process of making recommendations about that, but we do expect there'll be multiple rounds of funding. We are likely to recommend 3 rounds of funding for the smaller nonprofits. The larger implementation grants are something we want to work with nonprofits to do as they get audits in place and are in a position to do so.
Okay, good deal. As a nonprofit, the 3 rounds, if I'm a smaller one, can I get funding in all 3 rounds? Or we don't know yet?
We don't know yet. I hesitate to speak for the advisory board.
Okay.
They'll be setting that determination.
Okay, I just know in the past we had put some, and again, it's changed with the different administrations that we've had. So thank you so much. Oh, one last question, Chair. The new animal control positions, can we speak to that?
So that was on Councilwoman Stiles' wish list, and she spoke to it yesterday. I think it was and I don't have my notes in front of me, but it was she spoke directly to Metro Animal Control, and it was to address some deficiencies that they had in terms of being able to keep up with their work, disposal of animals. So this was a request from them to have these additional FTEs. And it was confirmed with the department head that this is a need for them.
Okay.
I'll do Councilwoman Allen, then Councilwoman Porterfield, and Councilman Young. Oh. Councilwoman Allen.
Thank you, Madam Chair. I just wanted to respond to the question about the earlier fee studies for Public Works. This is specifically to look at fiber installation, which is a relatively new thing that we haven't been dealing with on the scale that we are currently, and just many neighborhoods are experiencing projects that are proceeding without inspection because we don't have enough inspectors, and they are damaging irrigation systems and utilities and trees, and then they are leaving the holes wide open for weeks at a time, which is a safety hazard. And so it's not something that would have been covered in a previous fee study, and that's why I'm asking for I am approving the change, which I appreciate, to put in some money for a fee study so we can get those people on the ground as soon as possible, because it's happening right now and we need to catch up with it.
Councilwoman Porterfield.
Thank you, Madam Chair. I just wanted to thank you for working so hard on this budget, and to finance and everyone that contributed to this. And I know that this was not an easy feat to address so many of our wish list items. So I just wanted to thank you so much for this amazing, strong budget. And then I also wanted to make sure that we recognize that those 2 FT positions for social services are for the homelessness impact division. So I know Councilman Druffel did ask about his request specifically, but I wanted to make sure that we acknowledge that those positions were for that particular division. So, and I know we want to do more, Councilman Druffel, but I did want to acknowledge that that was there. Thank you, Chair.
Councilman Young.
Thank you, Madam Chair. I guess going back to what I was asking a little bit earlier, on a couple of these, I guess I'm just not familiar maybe with what that request would be, because if you look at the request, it doesn't maybe itemize out. And I guess specifically like the Metro Council, the $277,000 for that. I mean, how much are we looking at putting for travel or software and whatnot, or is there a breakdown of that? And then the like $200,000 for NBC LEO, what exactly is that as far as that money doing? So I don't know if there's on these requests maybe something a little more itemized, or saying what is the money do? I mean, some of it's obvious, like a fee study, right? But and I just couldn't find anything on that. And it may just be I didn't dig enough, but just a little guidance on some of those.
Oh, that's fine. So the council expenses, the original wish list request was for $650,000.
Right.
At one of the work sessions, Director Cooper spoke of staffing needs that he had identified, and I believe that came out to be about $140,000 or so. $142,800. Then there was the travel. As you know, the travel expenses for council to attend conferences was cut significantly. So $2,000 for each council person, so that's $80,000. Translation services, that was on Councilwoman Stiles' wish list, it was $55,000. And then the software needs, that's the Bang the Table, that was on Councilwoman Suarez's wish list for $25,000.
Gotcha.
And then the NBC Leo is the National Black Caucus Legislative, oh Lord, I'm messing that up.
Black Caucus
Local elected officials, there we go. Nashville is hosting the conference, I believe, next year.
Oh.
And Councilwoman Hurt is the incoming president of that organization. So
Okay.
that is hosting, putting money towards hosting.
All right. Thank you. I want to thank you for the inclusion of some money for the county clerk's office. Those are two positions that will be funded that actually had been cut in prior years, and that is an office that continues to get busier and busier. I was actually there this afternoon and seeing the pile of work continuing to just pile and pile up, especially from the auto dealers coming in, because more people keep moving here and they're buying more cars because we haven't quite figured out the whole mass transit thing here. So, and I was especially glad to see the money for the Friday hours at the library. So I thank you for that. And I think you did a great job of trying to balance out the needs and the reality that we still, believe it or not, we're not federal government. We don't get to print money here in Metro. So I appreciate that, Madam Chair.
Thank you, Councilman. Councilwoman Benedict and Councilman Syracuse, did you have your hand up?
Thank you, Madam Chair, and I'm not going to pat your back any more than what he just did, although I would love to double that. So what he did just times two without all the words. Not as verbose as normal. So I really appreciate your work on this. You've hit so many things that are critical, and again, you have balanced things really well. The one question that I have is on the mental health nonprofit partnering with MNPD. Can you line out what that's for? And is that one line item or multiple?
So it is one line item, and I actually have someone from the mental health cooperative here. You can actually come up to the front. That mic is really low in the back. Sit here in the middle. Not to embarrass you, but this is the better mic. So yeah, you can have a seat. Tell me your name again. I know it's Amanda Brock. Okay. So Miss Amanda Brock, who's a senior vice president with the Mental Health Cooperative, is here because, as you recall from previous discussions, we had talked about the HEALS program, and the Mental Health Cooperative is the organization that provides the crisis response services for Davidson County. And so they would be the organization that would have to take on both pilots. And so I'd asked someone from Mental Health Cooperative to come and speak today. So Miss Amanda Brock is here. Pam Womack, who's the CEO, she couldn't make it this afternoon. So Amanda has so graciously come to answer questions. And I especially wanted her to explain the rationale behind going with the co-response model versus the HEALS model, and as well as to speak some to that, the $818,000. That's to address a funding deficit that they have.
Correct.
So
to just clarify the co-response model and our support of that, that's been in the works for a while. Chief Drake, when he took over, immediately started conversations with our office because those were some of the recommendations that came out of the Policing Policy Commission, as y'all may recall, as well as the Mayor's Behavioral Wellness and Advisory Council. We had actually been talking about that before those recommendations came out, but we gathered momentum when Chief Drake again came on board and appointed Inspector Imhoff to work on that with our office. The mental health, for those of you who don't know, the Mental Health Cooperative, we are a non-for-profit mental health organization, and we have been the designated crisis response provider in Tennessee since 1993. That's a designation from the Department of Mental Health. So that's why we were in conversations with Metro PD about improving crisis response in our city. The co-response is built on what's called a crisis intervention team model that is a nationwide model that's been around over 20 years. It actually started in Memphis, where you train officers who volunteer and give them specialized training, 40 hours of intensive training on how to de-escalate mental health situations safely. And we took it a step further. The Memphis model, you just have officers responding. We wanted to go a step further and investigated a model out of Denver, Colorado, where they had started with CIT, and that worked well, but then they decided they needed to do more, and they developed a co-response model. And their co-response model is pairing clinicians, trained clinicians, to ride along with officers who've had that specialized training and work in a partnership to safely de-escalate those high acuity crisis situations. I know that there's been a lot of conversation about the HEALS program, which is a non-law enforcement response. It is a very valid program. But in talking to our colleagues across the country who have done this, they all started with CIT first as your foundation and evolved to co-response and then added on your non-law enforcement. I would love to tell you that we would never need law enforcement to deal with mental health crisis situations. Unfortunately, there are those situations that by the time that person comes to the attention and reaches for help, there's a dangerous element involved. There's a weapon involved. There's agitation. That's not the majority of cases we deal with, but those are the cases that law enforcement gets called on, and we want to ensure that when they do get called in those cases, they are properly trained and they have a clinician with them to make sure that it's a safe outcome for everybody involved.
You referenced the program in Denver. What's the name of that program? Do you know?
Their official name, I think it's Denver Co-Response, and they also partner with a community mental health agency. I can get you their official name because I probably don't have it correct.
Is
they
it
also
STAR?
Have, STARS is their non-law enforcement, is that what they just added, which is pairing a mental health clinician with an EMT. So that's the latest addition to their program.
Okay. I wasn't sure if that was the name or if there's another one. Okay.
Yeah.
That's all I have. Thank you, Chair. Mm-hmm. And thank you again for doing a great job.
No, thank you.
Councilman Syracuse, then Councilwoman Allen, Porterfield, Vercher. Oh, let me turn you on.
There we go. Thank you, Chair. Yes, I'll be the third person to say good job. Really appreciate all your efforts here. This might be a question for Director Cooper. The two administrative officer positions in the council office, can we get some clarity on specifics on those positions?
So I was asked just kind of to give an off-the-cuff answer in one of these work sessions. And so the two positions that I had been thinking of, one would be an additional legislative clerk, because Danielle is kind of drowning in legislation, especially since we've implemented the new legislative management system, which involves a lot of uploading. And so that would be one position. And the other would be someone to handle the scheduling and calendaring and public notice of meetings and things like that, so that Theo can focus on community engagement and some of the things that he is good at doing. So it's just to provide some more support for that administrative function, so he's not doing it all.
Very good. Thank you. I appreciate that. In regards to translation services, is that a contracted thing, or my thought or my brain is that if we have two extra positions, is there a need, and I think there is, to have some bilingual staff in the office? Would that be a combination? Is that what one of the positions might do?
So Theo is already can speak Spanish and uses that on a regular basis, engaging with the public. So he is already on staff. The $55,000 would be for contract services, like if there was a specific publication or something that needed to be translated into a certain language, then we would have the capability of utilizing that service for that.
Okay, yeah, very good, thank you. All right, my other question is under changes to Section 1, Schedule D, Event and Marketing. Can you talk a little more about that? What are we changing?
Chair, do you want me to
Yes.
address that
Oh,
one?
okay, yes, please.
So the event and marketing budget is set based upon anticipated revenue collections for it's the collections within the downtown area, right? So it's based on the collections which the downtown partnership thinks will actually, or is it the downtown? I'm getting my people confused. Or this is the CVC, right? So the CVC felt like that amount was actually lower than what was going to come in. And so this just sets the amount. Yes, they already had fund balance remaining, and so it appropriates that fund balance so that it basically it authorizes them to get more money this year, but it's not coming from the general government. It's money that is collected as part of the fund.
This is the Event Marketing Fund?
Yes. If you remember so let me make sure I'm talking about the right thing, because there were three things on here. Okay, yes, this is the resolution that the council just passed that approved the additional increase for the Event and Marketing Fund. That revenue has to be realized in the budget and appropriated for that purpose. So that's what this does. It just adds it in to realize that revenue now that the council has approved that additional amount for the Event and Marketing Fund, which is used for downtown partnership cleaning and maintenance.
So this isn't the Event Marketing Fund that is managed?
Right, it's part of the same statute. It just added an additional amount. Okay, I'm handing this over to Tom because I am so.
That's okay. I apologize. I thought it was a softball.
Now, this one actually is, the budget that was set was based on the initial revenue estimates, and they do have a fund balance. There wasn't a lot of money spent last year out of this fund, so there wasn't a lot of expenditures, but the fund balance is being appropriated so they can use that in addition to what the projected revenue is.
Okay, all right. Okay, that helps. This is a bit of an off-the-cuff question then. Does the mayor's office have a person represented on the Event Marketing Fund committee?
Yes, I attend the Event Marketing Fund committee meetings.
Great. Thank you very much. I appreciate it. All right, my last question then is, your sources are 16.2 million and expenditures are 15.8. So where does?
There's some funds from the USD. So if you look at the last page, or the second page, it's 15,807,100 from GSD, and then 424,800 from USD. So that equals up to the 16,231,900.
But expenses are only 15.8, right?
No, it's some of the expenses are coming out of the USD.
Oh, I see. Okay. Okay. That's it. Thank you so much, Chair.
Thank you. So I have several council members in the queue. If you have questions for Ms. Brock, because I don't want her to sit up here the whole time that we're talking. So raise your hand if you have questions for Ms. Brock. So I see Councilwoman Allen, Porterfield, Vercher, Councilman Nash. Okay, Councilwoman Allen, let me.
Thank you for staying. I just want to get some context on calls that come in that y'all respond to. I mean, when people call and say, I'm in a crisis, we need you to intervene, does that typically come to your phone number? Does it come through a hospital? Does it come through 911? What's the sort of split on that?
Yeah, it's a great question. All of the above. We get around 5,000 phone calls in a month of people who call our line directly. That's a combination of individuals themselves who are in crisis or family members who are in crisis, hospitals where somebody's ended up in an ER and they're asking us to come for a consult. It includes law enforcement calls. So those calls can be anybody. Of that 5,000, a lot we're able to address via the phone, but of those, about 700 a month we see face-to-face. When we see them face-to-face, it's either us dispatching a counselor into the community, into the emergency room, or bringing the individual to our office. In the last few years, we've seen a shift where a lot of people are preferring to come into our office versus going into us going into their setting. So around 250 calls per month are people who are brought in via us sending transport or them coming in on their own to our office for assessment. The rest of them is a mixture of seeing them in the ER, other community agencies, sometimes their home. So it's a little bit of everything.
Gotcha. That's very helpful. And then so if someone does call 911, is that automatically a police call, or do the 911 operators sometimes, are they trained to make a call that, well, maybe we can just go directly to mental health? Or?
That is a wonderful question, and that is part of the infrastructure we need to build, and is part of our planning with the co-response model. Because right now, majority of the, I can't speak for 911, but I've been in meetings with them. It appears as if a majority of the calls that come to them, there is going to be a response, whether by law enforcement or an ambulance EMS. So we need to retrain, and we've gotten the training materials from other jurisdictions that have done this to have more of a decision-making model at the 911 level. So we hope we are able to divert some of those that don't even need the co-response with the police and clinician that I referenced earlier, but get them routed over to us, but then also have them ask questions to determine when that co-response team needs to be dispatched.
Gotcha. And would some of this $818,000 additional funding that we're providing as part of this budget be helpful in, I mean, it sounds like what you're describing is a transition towards HEALS, which you're saying is something we should consider a not too distant future option anyway, and that for this year, if we can put the infrastructure in place for the co-response, HEALS may follow quickly on its heels, maybe?
Well, yeah, and let me clarify that $818,000 is to offset a deficit we have with our current crisis treatment center. So the crisis treatment center is a 24/7 location where people can come in. It's where they come in to be assessed, but also where they can stay for treatment. We opened that in 2019. We're currently operating at a $2 million deficit right now because of the rise in number of people coming in and the rise in people who are uninsured. We get funding if the individual has teen care or commercial, but if they're uninsured, there's some state dollars, but it's limited. So we've been operating in a $2 million deficit. That 818 is to help offset the deficit that would be left over and help us prepare for what we anticipate will be more people who need that service, because we think we're going to be identifying more people through the training with 911 as well as the co-response team. And then as to the development of HEALS, we definitely think that is something we need to look at down the road, but we need to get this particular pilot off the ground, gather data on it, see what works, and get the good, solid training in place from the time that person calls 911 to the time that somebody needs to respond and make that determination whether it needs to be a co-response response or a co-response, non-law enforcement response.
Gotcha. Okay, it's just helpful to me to sort of see how that all fits together. So I appreciate learning about those 7,000 or 5,000 calls a month that don't involve a police officer to start with anyway. So thank you.
You're welcome.
Councilwoman Porterfield.
Thank you, Madam Chair, and thank you so much for coming to speak with us today. We've been kind of discussing this at all the work sessions, and I've been advocating real hard for HEALS, so it is a little disappointing to hear that we don't have the infrastructure in place to do that this year. But I do have some questions for you. Do you have any data on the calls that are received currently from 911, the mental health calls that are received here in Nashville? Is there any data surrounding around how many times those calls end in an arrest?
I don't have that data, but I believe, I don't want to speak for the 911 center, but I believe they are collecting that data. And that is, as part of this pilot project, we are looking at the important data elements we need to track. So if they don't currently have that, that is certainly on the list of things that we need to track ongoing. Because we want to ensure that, that we're routing people the most appropriate way. One of the other areas of my responsibility at our agency is overseeing our mental health services at our jails. So the mental health co-op contracts to be the mental health provider in the DCSO jails. So I can tell you, yes, there are people who end up being arrested that shouldn't be. And with that ability to be able to access that information, and knowing that there are people there, part of this year will be reviewing those cases that we are missing, and how did we miss it? And being able to go back and say, wait a minute, we've got to redo our training because we missed those cases. We all know that there's far too many mentally ill people in our jails and prisons across this country. I think development of this solid infrastructure is a good step in decreasing that in our local community.
Thank you for that. Thank you for that response. Based on the co-response pilot, and let me say that I'm super thankful. Although I wanted co-response and HEALS, I'm very thankful for the co-response model. That was my first conversation with Chief Drake prior to Chief Drake becoming Chief Drake. Mm-hmm. My first conversation with him was advocating for a co-response model. So I'm thankful that we are moving in this direction. My question is, based on the pilot, the co-response pilot that we're looking at, do you believe that we'll be in a position, and I know it's hard to speculate, but do you believe that we'll be in a position, based on the data from this program, to implement a HEALS type program next year?
I think that definitely takes, we should put that into consideration for next year. I think we need to look at how the first pilot, and remember that this pilot is starting out with 2 precincts. I would like to see it expand across our city, but looking at that data and seeing lessons learned in that first year, and this time next year, we very well could be in a position where we're ready for that. I think the main thing we need to do right now is make sure we've got good training that starts as to the previous answers at the 911 level all the way down to determining who needs to respond. We need to get that in place first, and then I think progression to HEALS would be a next evolution, natural evolution.
Thank you. I just have a few more questions. Do we have any type of infrastructure in place currently? I know I've personally had to make a call for someone who was in crisis, and it was a cycle between not wanting to call the police, the person was in crisis, calling mental health co-op saying you have to call the police saying call mental health co-op, and it just being a very circular experience between the 2 agencies, both telling me to call someone else, and not really wanting to involve the police for someone who's in a mental health crisis who needed a doctor. Like I said yesterday, like I said last week, if I'm sick, call a doctor, don't call a police officer for me. So in a case like this, do we have anything to address what that would look like moving forward with this co-response model? Is that going to be ironed out so that families are not in limbo being told different things from 2 different departments?
Yeah, absolutely. That is part of the training and the decision-making model that we got from Denver about their call center piece. And it's important to note that we need to do better training for law enforcement, but also from a mental health perspective. The issue that we have right now is when the caller, if you're calling about a loved one in particular, that person's in crisis and you need somebody to respond right away. Absolutely, we need to be able to have a good response, but we also need to make sure it's a safe scene for all of those involved. And we need to do a better job of making sure that whoever's taking that call, whether it's a mental health person at a hotline or 911, is asking important questions to determine the scene, the safety of the scene. that bouncing that you're talking about is likely due to the fact that there was some indicator that they were concerned about safety. That's why mental health was giving it to law enforcement, and then law enforcement saying it's not enough and kicking it back to mental health. And we definitely, that's part of the training we're doing this week with the co-response team, is how can we navigate those in a better way.
Thank you. And Madam Chair, I'm winding down to my last two questions here. Do we know, or has it been decided how the data for this program will be collected and how this data will be reported to the council and to the community?
We've been meeting weekly with the health department. So the health department, as part of their involvement in this project, is going to have some epidemiologists who will help us collect the data, as well as an outside evaluator. I do not believe that outside evaluator has been selected yet. So I can't speak to the details of what they will be collecting, but it's going to be somebody who's outside of the mental health co-op, Metro PD, and I assume that you all would get access to that data on a regular basis. That would be my hope.
Thank you. That was going to be my request, those two things, that we get monthly updates on the data from this program, one, for the knowledge of the body, two, so that we can share this with the community, and three, so that we can make database decisions going into next budget season about the effectiveness of the program. And the other request was going to be that there was an outside agency collecting the data that was not MMPD, that was not mental health co-op, and I'm not sure, and this may be a question for Director Cooper, so I'm not sure if this is an appropriate use of the CLB, but could the CLB be an entity that's used to collect and review the data for this particular program? So Director Cooper, I'm not sure if you have that information or have an opinion on that.
Yeah, I don't know if that would fall within the scope of the Community Oversight Board or not, as far as what they are charged with doing, but we can certainly check.
Thank you. Thank you, Madam Chair, and thank you again for coming. I can't hide my disappointment right now with this, but I thank you for making the steps to head in the right direction with co-response. So thank you.
Thank you.
Councilwoman Vercher.
Thank you so much, Chair. I want to piggyback off of Councilwoman Allen's questions just a little bit, just so that I can understand how all of this intersects. So about 5,000 a month, 700 face-to-face, and that's direct crisis calls to the agency. So the police only intersects with that in the event a constituent calls either the non-emergency or the 911 number. Okay, I just want to be clear on that. And also, how does this intersect with Sheriff Hall, with the new behavioral care center? I know we funded 60 beds for immediate, and I don't think we talk about this enough as a city, for immediate mental health care for those crisis calls. Where do they come into play in this process?
Absolutely. Well, let me first, in terms of the numbers too, I should point out that of that total 700 that we see face-to-face a month, roughly 90 to 100 of those are ones that police actually were the first responder and they called us for assistance. And that assistance could be we went to the scene and met the officer there, or the officer brought the individual to our crisis treatment center. So that's been going on for a while. As to the Sheriff's Office Behavioral Care Center that opened in October of this past year, it is, right now it's staffed for 30 beds. You know, we opened in the middle of a pandemic, and
we funded 60 though.
Yeah, I can just tell you it is.
Okay.
Yeah, it's built for 60. Yeah. And right now we opened during the pandemic, and the referrals have been coming in. The way that works is right now the individual would be booked in, and they are immediately screened by a mental health clinician in booking. And then if they have a qualifying mental health issue and they have an offense that's on the list of approved offenses by the district attorney and the public defender, they are immediately screened by the DA assigned, the public defender, and a member of my staff who's a clinician. And if they all agree, they present the option to the client and give them the opportunity to transfer over to the behavioral care center. It's voluntary. So we want the client to want to transfer over. Once they're transferred over, if they complete their treatment successfully, then their case is dismissed. The DA goes back and dismisses the case. We've had good success. I will say the numbers are lower in terms of the people who've been in the program. That is largely due to, when we look at the data, arrests have been down due large part to COVID. And many people are bonding out a lot quicker as opposed to wanting to transfer over to a treatment program because bonds are lower right now due to COVID. We're starting to see more referrals coming in. I have not looked at the most recent arrest data. I'm assuming their arrests may be up right now, and that way it may be why some of the more referrals are coming in. But I don't have the most recent data on that. I will say the co-response model, we are training them on what the BCC, the Behavioral Care Center, will do. So in the event that the officer does have to arrest, and there's certain times an officer does have to arrest, if there's an outstanding warrant for that person, if there is a community member who's wanting to prosecute, they take them downtown, but we are also training them to say, wait a minute, this person also has an underlying mental health issue, to make sure that information gets relayed to the sheriff's office, and hopefully that person can get flagged appropriately for the Behavioral Care Center.
And when they're detained and in custody, for lack of better words, they are advised that they can transfer over to the BCC, and what that process is to have whatever the charges may be dismissed. But it's a process that they have to go through before those charges are dismissed. Am I understanding that correctly?
Yes,
Okay.
they are informed, they're in booking, and we try to do it before they're even dressed out and gone anywhere besides booking. They go straight over to the BCC if they agree to that process, so that they don't have the trauma of having to dress out and go into a locked area, the traditional jail, for lack of a better term. And they are repeatedly, we go over the treatment plan with them and explain to them if they complete that treatment, then the DA will go and the public defender will ensure that those charges are dismissed.
Okay, thank you so much. I know Sheriff Hall has been just an advocate, just not in Nashville, but nationally, as it relates to not criminalizing mental health. For the $818,000, and I don't know how I missed this, he says to offset a $2 million deficit, roughly?
A $2 million deficit, yes, ma'am. When we opened our crisis treatment center in 2019, that's where we assess people and treat people. They can stay overnight and get treatment and stabilization. We started seeing an uptick, which was great. We showed that the people needed the service. The volume went up a lot higher than what was originally projected, and the volume of people who are coming in who are uninsured, who there's no payer source for, went up dramatically. And in order to operate that service, you have to have medical staff, I think some previous points, nurses, doctors, and the cost for that has gone up, and the majority of our cost is in staffing. And so that $818,000 is the deficit we will have if the money that Mayor Cooper put in his budget for us, which is $1.2 million, is approved. We will still have an $818,000 deficit.
Okay, so would it be fair that, and this is just for our source and uses, that this $818,000 really isn't for this co-partnering? This is to offset the deficit.
It's to offset that deficit as well as to prepare for when the co-response model launches, we anticipate that volume continuing to trend up because we believe we will be identifying more people who will continue to need the service. And of course, as our city grows, we'll see that continue to go up.
Yeah, but the co-response is supposed to launch June 28th, correct?
Yes, ma'am.
So it'll be a year pilot?
Yes.
Okay, so as a legislative body, we won't have critical data to make decisions for the next budgeting cycle. So realistically, we're really looking at a year pilot, but 2 years in practice for the legislative body to pivot if need be. And I know that's not on you. I'm just making that statement for our colleagues. Chair, do we need to I'm just a stickler on what we put on paper is what we're actually doing. Just changing that language for this allocation of this funding.
I'm fine with that, Councilwoman Berger.
Okay, thank you so much. And it was mentioned that we are a model in Denver support team assistance response, their STAR. Are we doing it in totality, or are we taking away portions of it? I'm familiar with Denver's STAR program.
So what we're doing is not 100% totality, but we're
Okay.
a lot of their foundation. Like I said, they started with a pilot, just like we did co-response. Then they now have 30 clinicians across their entire city, and then they added their STARS program.
Yes, thank you so much. Talk to the colleagues there quite often. They're doing a phenomenal job there. Thank you so much, Chair.
Thank you, Councilwoman. Councilman Nash?
Thank you, Madam Chairman. As a retired police commander, I want to thank you for all the help your organization has given. I've been gone 10 years, and you were in business long before that, and it's been very helpful. Just before I left, the capacity of the city to find places, beds, was short many times. I had officers that had to transport patients to Chattanooga, Moccasin Bend. Has that gotten better?
Great question. I will say that finding an inpatient bed sometimes is still a struggle, and we still have times where officers have to transport people to Chattanooga or even West Tennessee. However, that's why we built the Crisis Treatment Center. We are able to treat more people there versus needing to send them to a hospital, and we're able to release officers now. Instead of an officer sitting at the old mobile crisis waiting for us to get a bed that may take 2 or 3 days, or waiting in an ER unnecessarily, they can bring the client to our office, and we have enough treatment staff now, thankfully to some previous funding that we got from the city, to release the officer and let treatment folks engage those individuals until we can secure that bed. And we do everything we can to secure a bed locally, so we don't have to transport somebody those long distances. It does still occur, but not the way it did 5 to 7 years ago.
That's good to hear. And I'm going to sneak in a little mental health issue. This job, the job of all our directors, is no fun when there's no money out there, or money is so tight, and as we have had to go through the last couple of years, and it is really a credit to, I think, our mayor to have stuck his neck out for the tax increase so that we have some funds to do what we need to do and provide the kinds of services like this service to our citizens. And I want to thank Madam Chairman for apparently working very well with the administration and coming up with, I think, a very good compromise budget, and credit to both the parties.
Councilwoman Sepulveda?
Thank you, Chair. Thank you for being here today. I just had a couple of questions. Is your nonprofit under the state, or do you receive state funding?
Yes, we do receive some state funding. We get dollars from the Department of Mental Health, certain grants, some grants for our crisis services, and some grants for smaller outpatient projects that we do. And then in our outpatient center, we also get funding from TennCare. That's the majority of our funding.
Okay, thank you. I did have a question, and part of it was answered when you said that the model in Denver had a co-response pilot before they went to Cahoots, is that correct?
A Cahoots-style program. That their STAR program is based out of the model, the Cahoots model.
Is there any city that you know of that that didn't do the co-response and went straight into what we're trying to do with the HEALS program?
I don't know for sure. I believe Eugene, Oregon, where Cahoots originated, started maybe with a CIT model, not a co-response, but training officers, and then went to their Cahoots model. But I don't know that for 100% certainty. That is the only city that I'm aware of that operates has operated a Cahoots model without a traditional co-response model.
Because I think there's several of us council members that wanted to see us go straight into the HEALS program and not the co-response. And to Councilwoman Vercher's point, if we do a pilot and it takes, a year, and then we have to reevaluate the data, and every time we try and do something new, the timeline always gets pushed down and pushed further back. And I don't want to see that happen. And so help me understand why we can't have a pilot in the other precincts and do it simultaneously at least. I just want to know what infrastructure we need in place to go straight into the HEALS program.
A lot of what we need let me first say, in order to get a pilot like this off the ground, it takes a lot of time and it takes a lot of resources from all of the agencies involved. I can only speak for my agency is that right now for this year, I don't have the resources in order to try to get 2 pilots off the ground at the same time. And I fear that if we try to do that simultaneously, we're not going to be effective in either one. We're going to be stretched too thin, for a lack of a better term. And I think the other thing is having the basis for really doing that solid evaluation and training at the front end, at that call level. If you spread that knowledge too much and you try to put too much information with people, you risk just diminishing both programs is the concern that we have. And quite frankly, I just don't have the manpower ready to go and launch both of those programs in this year.
If we provided more funding to be able to do the HEALS program where you can hire more staffers, would you be willing to commit to implementing the HEALS program along with this co-response?
That is a discussion I would have to take back to the rest of our leadership and see what our capacity is, because I would love to say yes, we'd be able to do that, but you not only have to identify staff, then you have to get them trained, and you have to keep your existing operation, your existing infrastructure in place in order to do that. And I'm not in a position to be able to commit to that right this minute. I would certainly take that back, and we would discuss what our resources are.
And I have one last question. Does your nonprofit provide services in other language?
Yes, we use interpreter services, but we also have individuals on our staff in our crisis service who are bilingual, primarily Spanish-speaking individuals. That we do often have to use interpreter services, not only for those who speak other languages, but those who are deaf and hard of hearing as well.
Great. Those are all my questions. Thank you.
Mm-hmm.
Are those all the questions for Ms. Brock? Thank you. Councilman Cash?
Thanks. I'll just have a quick comment and a pat on the back. I think the first work session, we talked about the request for like $650,000 for council staff, and there was a discussion. There were kind of 2 discussions. One was about not having fully had the conversation about looking at reorganizing and collecting data from us about our needs. And I, along with others, and rightfully so, kind of said we don't want to allocate money before we've kind of figured all this stuff out. But then we started learning about some of the specific needs. So I'm glad that you took those needs and those staff, kind of put some help in there for the staff people that are really working hard and need some help and relief. So I appreciate you doing that. Do we know how the translation services, like we will contract out is what I'm hearing, but so is that something like we can submit, do we know if we can submit something in writing, like a newsletter, and we can get it translated for us, or is it just when something comes in, or do we know any sense of how that works? I know we still probably have some questions.
Director Cooper?
Yeah, I don't think we know at this point. The contract would have to be through Metro. Metro already has some contracts, so it could likely be a piggyback onto that or a change of scope of services. All that would go through Metro procurement. But as far as what actual services they would provide, I don't think that's been determined yet.
But we know that like both spoken and written are possibilities.
That's my understanding of the purpose, yes.
Okay, thanks.
Councilwoman Vercher.
Thank you so much, Chair. I would be remiss if, I believe there was a question earlier about administrative and econ development about NBC Leo. Colleagues, what that is, that's the oldest constituency group for elected local African Americans. Actually, it's older than the the Congressional Black Caucus. Our esteemed Councilwoman Hurt, she will be the president of this constituency, which will bring that summer conference to Nashville, the first time ever. We'll be bringing local elected African Americans and others from across the country here to Nashville for our summer conference. So that's what NBC Leo is. It's the oldest constituency group for local elected African Americans. Is older than the Congressional Black Caucus. Thank you, Chair.
Thank you, Councilwoman. Are there any other questions regarding the substitute? Councilwoman Allen.
I hadn't taken my chance to say great job, so I'll do that as well. Is Mr. Crumbo still in the room, or did he get away? Or maybe someone else can answer. Just two questions on the on where the revenues are coming from. One of those is 6.5 million reduction in judgment and losses, and we pretty consistently have judgments and losses, at least to every council meeting, it seems like. So is that because we've done such a good job of building up that cushion that we have money left over from last year and we don't think we'll need it this year? Or if someone could just go through the math and tell me how we feel about that.
Tom.
Actually, in FY20, this current year, there was a supplemental due to a couple of extraordinary cases. The original amount of $13 million was to help the legal department. There's an actuarial study that happens every year or every couple of years to determine what this amount should be. We have not reached that level in many years, but as you said, there's judgments and we appropriate money as necessary. We were trying to get closer to that actuarial amount. This is still more. Last year's budget was about $1 million. We ended up doing a substitute. I don't remember exactly what it was, but I mean a supplemental. But this still gets them more than they've been getting, and hopefully we'll be building that up over the years.
Any other questions regarding the substitute? So, as you all know, Budget and Finance Committee meets on Monday at 4. Are we still at 4 o'clock? At 4 o'clock, and we are here? Okay, so 4 o'clock Monday here in the chambers, talking about the capital improvements budget as well as the operating budget. So see you on Monday. Oh, Councilman Young?
Operational question. What is the deadline for any amendments that any council members would like to file to the substitute?
According to the rules, it would be tomorrow.
Right.
If you could get the request into our office so that we can have Thursday and Friday to get them prepared. But that's the.
I'm not saying I'd have any. I'm just.
The preferred method.
I'm over here giving you the evil eye.
My amendment was going to include a pay raise for whoever chairs the budget committee, Madam Chair. So don't evil eye me.
Any other questions? All right, see y'all on Monday.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.